I want to begin by accepting the committee suggested amendments as outlined in page 4 of the analysis, and want to thank the staff for their support and assistance on this bill. We often celebrate the birth of children, but through each experience also emerges the rebirth of a woman whose story is often forgotten. Maternal mental health disorders are the most common complications of pregnancy, and the risk factors associated with maternal mental health stigma persist. Depression and anxiety can increase a woman's feeling of isolation, confusion, and avoidance. Women who experience maternal mental health disorder may not ask for help, and additional burdens such as a lack of transportation or poverty can contribute to poor detection and treatment rates. According to the Department of Health, 1 in 5 California women who recently gave birth experienced symptoms of depression during or after pregnancy. This means that approximately 100,000 women in California experience this every single year. One major obstacle to addressing this crisis is a lack of mental health care providers. For instance, there is only one identified reproductive psychiatrist in Riverside and very few counseling and support services for women in the district that I represent. This is very true statewide. There is minimal services available in many rural areas of our state to support women suffering from postpartum mental health disorders. The ongoing shortage of mental health specialists, including psychiatrists, make it difficult for women to access mental health services like counseling. In Riverside County, rates of prenatal depressive symptoms and postpartum depressive symptoms are both higher than the state average. AB 798 will create a pilot program based on a model used in Massachusetts to provide psychiatry, teleconsultation, and virtual mentoring services. This pilot program will operate in several counties, including Riverside, to increase the capacity of health providers serving pregnant and postpartum women up to 1 year after delivery. AB 798 will help make important progress toward ensuring that women with maternal mental health disorders can receive the treatment that they need and deserve. Postpartum support during this critical transition sets the stage of a woman's well-being for many years to come. We must not allow women and their families to continue suffering in silence.